The continent of Africa is on the brink of a public health emergency. At least 12 countries have been affected by the latest outbreak of Mpox. The African Centers for Disease Control and Prevention, or the Africa CDC, is likely to declare a continent-wide public health emergency over the growing Mpox outbreak. The CDC says because of increase in Mpox cases and its continued spread across borders, it has resolved to start active engagement with African Union member states to prevent the outbreak from becoming another pandemic. A total of 887 new confirmed and suspected cases of Mpox have been reported in Africa in 1 week, pushing this year's total to over 15,000. The cases have increased 160% compared with the same time period last year. The CDC announcement came a day after the World Health Organization said it would convene an emergency committee meeting to determine whether the Mpox spread in Africa should be declared a global emergency.
In light of the spread of Mpox outside DRC and the potential for further international spread within and outside Africa, I have decided to convene an emergency committee under the international health regulations to advise me on whether the outbreak represents a public health emergency of international concern. The committee will meet as soon as possible and will be made up of independent experts from a range of relevant disciplines from around the world.
Let's break down what we know about Mpox and the current outbreak so far. Now, first things first, what is Mpox? It is an infectious disease caused by a virus. The symptoms include fever, chills, and muscle aches, and are typically followed by a rash that starts as raised spots, which turn into blisters filled with fluid, and these eventually form scabs. There are broadly two different types known as clades. Now, clade 1 was once known as the Congo Basin clade. Now, the clade 2 as the West African clade, and both can be fatal, but clade 1 has had a higher death rate. Now, the Africa CDC says 34 countries in Africa are either reporting infections or are considered at high risk. At least 12 countries have reported cases so far, including the Democratic Republic of Congo, which has more than 90% of the cases. Some countries like Burundi, Kenya, and Rwanda have reported Mpox cases for the first time. Like I mentioned, the most severe outbreak is in the DRC, which has over 90% of the cases in Africa. 511 Mpox deaths have been reported this year. Cases of a deadlier strain of Mpox have been confirmed in 4 countries. A new offshoot of the clade 1, called clade 1b, has been detected in East DRC. It has also been confirmed in Kenya, Rwanda, and Uganda.
The fatality ratio overall in the Democratic Republic of the Congo is around 3.6%, higher in endemic areas and especially in infants and young children, and lower in the eastern part of the country at the moment, where spread is more rapid through sexual transmission.
Earlier, clade 1 typically spread by people eating infected bushmeat, but clade 1b is spreading person to person, often via sexual contact. It is also spreading through other physical and face-to-face contact or via contaminated bedding or towels.
We live in an interconnected world, and these pathogens do not respect borders. So I just want to get across the urgency that we're trying to say that the action is now, the time is now for us to take much more measures and provide much more support to the African region, to the countries that are affected across the entire spectrum, from surveillance to prevention to risk communication to clinical care to infection prevention control to R&D to the use of vaccines. It's now.
There are vaccines, but there are issues with access. Africa CDC says it needs 10 million doses, but only 200,000 are available. Authorities say a lack of treatments and diagnostics is hampering the response. Plans for vaccination programs are still under review, but other plans, including tracing and vaccinating contacts of cases, could be launched.
There are 2 vaccines for Mpox that have been approved by WHO-listed national regulatory authorities, and which are recommended by WHO Strategic Advisory Group of Experts on Immunization, or SAGE. I have triggered the process for emergency use listing of both vaccines, which will accelerate vaccine access, particularly for lower income countries, which have not yet issued their own national regulatory approval. Emergency use listing also enables partners, including Gavi and UNICEF, to procure vaccines for distribution.
Now, for more on this, we have with us Dr. Sultani Matendechero, the Deputy Director General at the Ministry of Health, Kenya. Welcome to Firstpost.
Thank you, and thank you for having me.
Right. Now, like I mentioned, Africa is on the brink of a public health emergency due to the rapidly increasing Mpox cases. How alarming is the current outbreak?
Yeah, so I would just like to confirm that yes, we have been able to record some Mpox virus infections, and specifically because in Kenya, where I can be able to speak for, we have been able to confirm one case, and we are aware that there are also a few other cases in other areas. However, whether this constitutes a public health emergency of international concern, that is not yet declared. So we can only wait until the full process is undertaken, because there is a procedure that has to be followed before any kind of public health issue like this one can now be declared a public health emergency of international concern. But what we can say as at now is that there are some cases. Yeah.
Right. And what are the measures that could be taken to interrupt the transmission of the virus in the affected countries?
So the quick and behavioral measures that we are currently encouraging are trying to avoid contact, because this is a virus that is transmitted through contact. So if we avoid contact with especially with the infected persons who are already displaying signs and symptoms, then it contributes to a very large extent to being able to stop the transmission of the virus. Secondly, we are also encouraging that, of course, as part of avoiding contact, those who display the classical signs and symptoms should really, present themselves to the health facilities nearest to them, so that they can self-isolate or they can be isolated from the general public and even managed at the same time. However, it is good to note that Mpox is a viral disease that also has vaccines. So it is possible for us to also vaccinate, which is a very effective way of being able now in the long term to be able to stop the outbreaks and even transmission at large.
Yes. That is very good to know. Doctor, a COVID-19 surge and the pandemic transformed the way of living. Could Mpox outbreak in Africa also force people to bring in changes? If yes, what steps could people take on an individual level to avoid the spread of infection?
Yeah, COVID-19 was fundamentally different when you look at it in terms of the natural history, even the symptomatology and the cause of disease. We are seeing fundamental differences here, because when we talk of Mpox, we are talking of a disease that has a very low case fatality rate. We have variants. So one of the variants actually, which is less virulent, the West African clad, we call them clads. The West African clad, the mortality rate is less than 1%. And when it comes to the other Central African clad, then the Congo Basin clad, the mortality rate is about 5 to 10%. So you'll find that we might not really have the same level of changes that we observed when it came to COVID-19. However, we are still concerned because unlike COVID-19, this is one disease that actually has very extensive cosmetic, effects, and at the same time, it also has quite a bit of stigma related to it, because when we talk of contact, one of the key ways of contact is through sexual contact, and so there's a bit of stigma that is related to it, which many times complicates the interventions that we implement. So it is bound to change the way in which we do things, but not as fundamentally as COVID-19. Now, how do people go about trying to prevent transmission? As I have already said, first of all, we avoid contact with infected people. Number two, we observe hygiene, wash our hands more frequently, and, with soap and water. And also, where necessary, we need to, use protective equipment, such as masks, when we are in crowded areas. And even when we are handling things and people, we can also probably consider using other protective equipment like gloves and so on, especially in the clinical areas.
Right. Right. And Doctor, the Democratic Republic of Congo has reported the highest number of cases and a new deadlier variant. Can you share any details on this?
I might not be able to share specific details about the Democratic Republic of Congo because the ministry responsible for public health in the Democratic Republic of Congo would be better placed to give such details. But indeed, we know that some of the cases that have been confirmed have been actually found in the Democratic Republic of Congo. I cannot speak with authority around the numbers. We know that most of the cases are of the Central African clade, which I said is a little bit more virulent than the West African clade. And one of the things about this particular, strain is that it has much better efficiency when it comes to human transmission. Remember, Mpox is a zoonotic disease. It can be transmitted from animals to humans and also between humans. So this one has a better efficiency, the one that is predominant in the Congo. But with regard to the details, then I would advise that either we get authorities from the Public Health Ministry to give the details, or the World Health Organization, because this is something that we also report to the World Health Organization.
Yes. Right, and the World Health Organization has convened an expert group to determine if the increasing spread of the Mpox virus in Africa warrants being declared as a global health emergency. What are your thoughts on this?
Yeah, that is one of the responsibilities of the Director General of the World Health Organization, because when cases are reported of such a public health issue, then, of course, depending on how it spins out, then sometimes it might need to be considered for declaration as a public health emergency of international concern, because this is a virus that is showing tendencies of fitting the bill of a public health emergency of international concern. Number one, it has shown the ability to move from country to country across international borders. Number two, it is also, it is a virus that it is an infection that can easily, can easily overcome some of the public health facilities that we have, so that we really need to be aware in terms of detection and to handle such cases. So the Director General is mandated to convene the emergency committee, which from reports, I think he's considering doing that. And when the emergency committee meets, then they will consider the merits of this infection and determine if it meets the criteria of being declared as a public health emergency of international concern. However, I just want to add that one of the criteria that is very important for declaration of a public health emergency of international concern is that we should be able to see cases in several regions in the world. What we are seeing here is a situation where the cases are confined to the African region, but then these are issues that will be handled by the emergency committee, which will now advise the Director General accordingly.
Right. And what is the situation via the Mpox in Kenya right now, and how is the government there handling it?
So as I had said earlier, we were able to detect one case of a suspected case of Mpox infection at the Kenya-Tanzania border while he was crossing into Tanzania, traveling towards Rwanda. We took samples and we were able to confirm that this is an Mpox case. We immediately went into action. We heightened our surveillance. We instituted contact tracing. We also issued case definitions to our teams, and we also beefed up our health facilities. Now, so far, we have been able to run quite a number of samples, which we have collected from contact tracing and also from suspected cases. So far, we have not gotten any other additional positive case. And we have also been able to constitute what we call an incident management team. We have formed an incident management structure, bringing together all the relevant stakeholders who are supposed to participate in this response. So far, we are confident that if any case comes in, we have screened more than 120,000 people who are coming in through our borders and our points of entry. And we are sure that we are now very well equipped to detect any other case that would come in. And if there is any other case in the country, then we should be able to detect it as fast as possible. And one of the things I'd like to say is that we are also encouraged by the fact that the transmissibility of Mpox is not as bad as we would imagine. And so we are not very worried of a widespread outbreak. We believe that with the measures we've put in place, then we should be able to contain the situation as it is right now. Thank you.
Fantastic. Right. Doctor, thank you very much for being with us on Firstpost. Very glad to have you and your valuable insights. Appreciated.
Thank you. Thank you very much, and thank you for having me.
Across continents, one powerful news source.
Bringing you diverse perspectives on the issues that matter.
We go beyond the boundaries to give you that little extra about every sporting moment. So thank you for making Firstpost 5 million strong. We're counting on your support, and you can trust us to bring you the news unfiltered and unvarnished.
Climate change is on our doorstep. It's time for a revolution to take root. And it starts with 1.4 billion Indians. It starts with one tree for humanity, one tree for Mother Earth, one tree for a future. Project One Tree, a News 18 network initiative.